Hi, I'm Adam Chesler with VillageMD, a founding member of the Primary Care for America collaboration. Primary Care for America is a diverse collaboration of key partners focused on educating policymakers and health policy influencers about the value of comprehensive, continuous, and coordinated primary care. Its formation serves as a commitment to our continued effort to help improve the well-being of the individuals, families, and communities that we serve. VillageMD is an organization which is focused on changing primary care to a model which is comprehensive, continuous, and coordinated for all patients, regardless of their background or income. By focusing on patient outcomes and not procedures, we're able to provide care for patients and not to patients. This quality care requires data, analytics, and a comprehensive team of healthcare professionals led by a physician but centered around the patient. Through our subsidiary, Village Medical, we currently provide care for about 1.6 million patients in 14 states, with a commitment of having 50% of our locations based in underserved communities. We truly are dedicated to providing the right care at the right place and the right time for our patients. We are also committed to and see immense value in integrating pharmacy and primary care. According to the Institution of Medication Safety, 20 to 30% of medications that are prescribed by a provider are never picked up by a patient. Additionally, 30 to 40% of chronic disease medications are either discontinued, taken incorrectly, or not picked up on time. This is well known as medication non-adherence. Many estimates show medication non-adherence costs our healthcare system about $290 billion a year. We all know if a patient doesn't get their medication, they can't get well. We also know through a study out of Oregon that when access to medication is provided on site, non-adherence drops from that 20 to 30% down to 5%. By providing coordinated pharmacy with primary care, we can improve adherence and outcomes for our patients. The coordination between pharmacy and primary care doesn't stop here. Specifically, the integration of pharmacy and primary care can result in further cost savings and improvements by not only removing barriers to accessing medications, but also addressing suboptimal dosing or choices of medication, drug interactions, patient lack of understanding and errors resulting from siloed communication. The coordination between pharmacy and primary care doesn't stop here. Specifically, the integration of pharmacy and primary care can result in further cost savings and improvements by not only removing barriers to accessing medications, but also addressing suboptimal dosing or choices of medications, drug interactions, patient lack of understanding and errors resulting from siloed communication between the pharmacy and primary care. Here at Village, we have 3 pillars of integrated pharmacy care. Number 1 is the shared electronic medical record. This allows us to no longer work in silos and gives us the opportunity to prevent errors by aligning medication lists and removing barriers to allow a more comprehensive medication review. Number 2, we set up a common communication platform. This allows the pharmacist to function as a part of the care team and resolve patient concerns immediately. And number 3, we utilize delegated authority and collaborative practice agreements. In turn, this allows us to remove the red tape which provides for things such as bridge refills or therapeutic interchange, as well as statins for patients with diabetes and more. As our integration continues to grow, we move into utilizing pharmacists to assist with closing care gaps, disease state management for complex patients, assisting with transitions of care for post-discharge for high-risk patients, and plenty of other opportunities. By integrating a pharmacist on the care team, we bring in the medication expert and remove barriers to providing care for patients. But we need payment models that support primary care practices to integrate with pharmacy. We have very clear opportunities to improve patient outcomes and access to care through collaboration, but if we continue to operate in these separate silos and not include payment models which support pharmacy integration, it's our patients who will continue to suffer. We look forward to partnering with policymakers and health policy influencers to make pharmacy integration possible for all Americans. Visit primarycareforamerica.org or villagemd.com to learn more.